First aid. As soon as accidents occur, the victim must be given medical aid before a doctor can reach or before the victim can be taken to a hospital. The first help given to the victim is called first aid. Different kinds of injuries need different kinds of first aid. Here are some ways first aid. First aid for wounds. First aid for nosebleeds. First aid for burns. First aid for fracture. First aid for snake bite and first aid for animal bites. First aid for wounds. Through the wounds or cuts, germs can enter the body. Germs from dirty hands can make the wound worse. So, wash your hands. If the wound is dirty, wash it with boiled and cooled water. Clean the wound with cotton wool. Wash the skin around the wound away from it. Apply tincture of iodine. Bandage the wound with a cotton pad and soft cloth to keep out the dirt. If the wound is deep, it is very important to stop the bleeding. If the blood is dark red and flows evenly, place a hard pad of clean cloth on the wound and bandage tightly. If the blood is bright red and flows in jerks, pressure on the wound can stop the flow. A tight band called tourniquet is twisted around the wound. The bleeding stops because of this pressure. A doctor can tell if an anti-tetanus injection should be given. Tetanus is a deadly disease. Its germs can enter through open cuts or wounds and cause blood poisoning and death. First aid for nosebleeds. When your nose bleeds, you should give yourself first aid. Loosen the clothing around your neck. Sit upright with your head held back and arms folded above the head. Press the bleeding side of your nose firmly with your fingers. Get someone to keep an ice pack or wet cloth on your nose and on the back of your neck. An ice pack is made by keeping ice cubes on a clean handkerchief and folding it into a ball. Breathe through your mouth. Do not blow your nose for a few hours after the bleeding stops. For heavy bleeding, a doctor's help must be taken. First aid for burns. Accidents with fire are very common, so we should know what first aid is to be given to a patient with burns. Burns can be caused by heat or by chemicals. Minor burns can be treated at home. Applying cold water or ice on the burnt area gives relief from pain. For slight burns, apply a solution of baking soda. When our skin gets severely burnt, blisters are formed. In case of severe burns, make the patient lie down and place a clean piece of cloth over the burnt area to keep out air. Keep the patient's head and chest a little lower than the rest of the body. If he is conscious and can swallow, give him plenty of liquid to drink. And then send the victim to the doctor. In case of chemical burns, wash the area with water immediately. Then cover the burnt area with a clean piece of cloth. Then follow the rest of the treatment as for heat burns. When we have to look after a person with burns, we have to follow 3 rules: prevent shock, prevent infection, and control pain. First aid for fracture. When a person breaks a bone in his body, we call it a fracture. You will know it is a fracture when the victim is in great pain and unable to move the broken limb. The place of injury swells up rapidly. A fractured bone needs proper support to prevent further injury. So, as far as possible, do not move the patient. If the patient has to be moved, first tie a splint above and below the fracture. The splints must be long enough to extend well beyond the joints above and below the fracture. If the bones of the arm are broken, the injured arm should be further supported by a sling. If the leg is broken, it should be tied with splints. The injured leg should not be moved at all. If the patient has to be moved, he should be carried on a stretcher. First aid for snake bite. All snakes are not poisonous. In case a poisonous snake bites a person, it should be treated as a serious emergency and immediate attention should be given to the victim. The snake poison travels very fast through the blood and affects the heart and the nervous system, causing death very quickly. So, get the poison out of the wound of the victim as quickly as possible. This is done by making cross cuts about half a centimeter deep over the wound with a knife and then sucking the wound and spitting out the poison. This should be repeated a number of times. Apply a tight bandage just above the wound. It prevents the poison-laden blood from reaching the heart. If possible, apply an ice pack over the bite. Wash the wound with potassium permanganate. Then carry the victim to a doctor. In case of snake bite, do not let the victim walk and do not give alcohol in any form. Do not use wire, rope or twine for bandage. Do not cover the bandage in snake bite. First aid for animal bites. Dogs, wolves, bats and cats sometimes carry in their bodies the virus of a very dangerous disease called rabies. When such an animal bites someone, The virus enters the victim's body through the animal's saliva. So, first wash the bitten part with soap and running water to wash away the germs. Bandage with a sterile gauze after gently rubbing an antiseptic over the wound, and take the victim to a doctor immediately.